I now request Grace Bessie to present on the topic Bacteriology of Urinary Tract Infection in Children Attending Federal Hospital in Abuja. Over to you, Grace.
Okay, thank you. Good morning, all. My name is Basi Grace Mfon. Currently, I'm a PhD student in Texila, American University, and I'm reading public health. I've been in the conferences, I've been presenting. I don't just really know what happened today. So my topic mainly is on bacteriology of urinary tract infection in children attending Federal Staff Hospital in Abuja, in Nigeria. So you can see the outline of my studies. Because of our time, I will not go through it. Introduction, purpose of study, problem to be solved, study area, and so on. Permit me to go ahead to the introduction. So, like I said, urinary tract infection is an infection in the urinary tract involving the ureter, the bladder, the kidney, and the urethra. These are the structures that urine passes through before being eliminated from the body. It is understood that the infection targets the different parts of the urinary tract, and as a consequent result, in the contagion of the lower and upper urinary tract. The infection is named based on the site of infection. So introduction continues. You know, UTI among the most common bacterial infection. Oh, I have to remove this. Okay, in humans, UTI among the most common bacterial infections in human, in some communities and hospital settings, and occur in all age groups. And also is an infection which is a leading cause of child morbidity and mortality, and is one of the most commonest cause of renal diseases in childhood of 1 year to 6 years of age. My references are all there in numbers. UTI is a term applied to a variety of clinical conditions ranging from asymptomatic presence of bacteria in the urine to severe infection of the kidney with resultant sepsis. And like I said, UTI is defined also as the growth of a known bacterial pathogen more than 1,000 colony-forming units per mil in association with a positive dipstick or urinalysis, using maybe combo, steak, and so on. So introduction continues. According to the National Institute of Health and clinical size these guidelines, urinary tract infection is defined by the combination of clinical features and presence of bacteria in urine. The clinical symptom of UTI usually includes frequency in urination, dysuria, pyuria, abdominal pain, back pain and fever, and sometimes you see blood in the urine, and also these infections are much more common in girls and women than in boys and men younger than 50 years of age. The reason for this is not well understood, but anatomic differences between the genders, a short urethra in women and might be partially responsible. You look at, we are going to be seeing the anatomy soonest in my presentation. You see that for the women, their urethra is shorter than that of the men. And that is also one of the main causes of these infections. So about 40% of women and 12% of men have a urinary tract infection at some time in their life. So then what is the main purpose of this study? The study to study bacteria involved in UTI in children attending the hospital, and also to identify the common bacteria associated with UTI in children attending the hospital, and also to relate the prevalence of UTI to age groups and sex, and also maybe offer a possible treatment pattern. So now, what is really the problem to be solved? Urinary tract infection is a common urinary tract pathogen in children besides bedwetting. Also, nuclear renal scans suggest that the vast majority of febrile young children with UTI have pyelonephritis, putting them at risk for renal scanning and the long-term sequel of hypertension and renal failure. It is imperative that physicians identify these children to institute early treatment, evaluate also the urinary tract, and monitor for recurrent UTI in UTI. Then my study area. The study area is a Federal Staff Hospital, Abuja ground floor, Federal Secretariat. In the laboratory unit, I was the head of the laboratory there, so I was opportune, to have a contact with most of these children coming into the hospital. And also, it also shows the ethical clearance. What ethical clearance was sought and obtained from the institutional bodies, and also it was reviewed before the commencement of the studies. So now we are going to also the sample size and determination and sampling. The minimum sample size was calculated based on the general formula, Fisher et al., SPSS, Statistical Package for the Social Sciences. And also that's a reference, and using this formula and using the formula above, the minimum size is 195, but a total of 300 samples was collected, for the study. And sample size greater than the value determined by the formula was used to improve precision estimates of the study. So then inclusion criteria were children attending the hospital itself, with symptoms of urinary tract infection, and also exclusion criteria were also children that were currently on antibiotics, because this will eventually affect the cultures. So the risk of circumcision, many studies have suggested an association between UTI and the uncircumcised status, although these studies have been criticized on the methodological grounds. And in fact, now, today, circumcision, most especially of women, is discouraged. It's no longer encouraged, except maybe in some rural areas due to their cultures and so on. But we try as much as possible when we go for all these visits and so on to discourage them and to tell them the implication of this female circumcision. A recent case controlled a study on 144 children under 5 years of age showed that circumcision was strongly associated with a decreased risk of symptomatic UTIs. And then we also have complicated urinary tract infections. Complicated urinary tract infections occurs mostly in men and in women, or at any point in life, and has the tendency of producing an outcomes or resulting in death under serious circumstances. These infections are highly intricate and are difficult to treat, and they are persistent. It can lead to outcomes like structural abnormalities that blight that capability of urinary tract to flush out the urine, and this in turn provides better scope for the growth of bacteria, as urine is considered to be a suitable growth medium and lead to their consequences. So in the United States, urinary tract infections also account for more than 7 million visits, to many offices, hospitals each year. Urinary tract infections are much more common in adults than in children, but about 1 to 2% of children do get urinary tract infections. Urinary tract infections in children are more likely to be serious than in those in adults and should not be ignored, especially in younger children. So then this is the anatomy. As I said earlier, this is female urinary tract. You can see the ureter, looking right down, the ureter is very, very short. That's the tract in which it goes. So because of this shortness, it's prone to several infections. So we also see the anatomy of that of the men. You can now see the urethra, this is longer as compared with that of the female, as I showed earlier. You see all the structures, the kidney, the ureter, the bladder, all the structures in which the urine passes through. So then we also have vesical urethral reflux, that is backward flow of urine. When urine does not flow down in the normal way, it goes back up, up back to the kidney, and this is very, very bad, and dangerous. So we also, like I have the bacterial isolate from urine of children attending Federal Staff Hospital. In looking at this, like I had 300 isolates, 300 samples. Out of 300 samples collected, and then I had about 20 positive results for Staph aureus, 7% prevalence, and then for streptococcus, and in fact for streptococcus, it must have been either wrong collection or one thing or the other, because urine is termed as a sterile site. So any organism that is being found in urine is regarded as pathogenic. So I also have here Escherichia coli, 62 positive cases I had, and 21% prevalence. And then I have Klebsiella species, 30 positive cases and 10% prevalence. And then Pseudomonas species, the 3 positive cases and 1% prevalence. And then proteus species rather, and then Pseudomonas aeruginosa, 2 positive cases, and then 1% prevalence. And then I went further to also check the antibiogram to see which antibiotics is best fitted, for the treatment of these cases. You can see in here on this table, Staphylococcus aureus, I had 20 isolates, and the best from my antibiogram here, the best antibiotics I can say here is ciprofloxacin, which can best treat for the Staphylococcus aureus in this case. And then going down, you see streptococcus, you can see little or no sensitivity was seen. We go to Escherichia coli, which was about 62 isolates, and then you can see the best treatment for this. You can use cefuroxime. Cefuroxime is very, very good. Followed by we can say gentamicin. Even though we tried not to bring in injections, we try to administer the tablets or syrups where necessary. We also have Klebsiella species, where I had 30 isolates, and from my antibiogram, I've seen that ciprofloxacin, is most suitable. Well, also gentamicin is okay, well, also followed by I should say cefuroxime, as well as cotrimoxazine. No, not really. Ofloxacin is okay. So then I also have proteus species too. You can see just to isolate, but if at all there is anything like that, so well, maybe we can go in for amoxicillin. Then we also have Pseudomonas aeruginosa. You can see sensitivity was really nil, but in case of any treatment that should be administered, gentamicin is most appropriate, as well as ofloxacin. So now discussion and conclusion. Urine is one of the sterile body fluids, but when it is colonized with bacteria, all the structures of the urinary tract is obstructed and is affected of being invaded. In this study, about 24 or let's say 9.6% gave significant reason for the absence of the bacteria recorded in 1 or 80 samples may be seen, with patients, or 88 patients was seen undergoing antibiotics therapy collected from the urine. After interacting with some of them, they were already on these antibiotics before even coming for testing, and this didn't really yield a good result. In this study also, the most Predominant organisms isolated among the children attending Federal Staff Hospital in Abuja were Escherichia coli 21% and Klebsiella species 9%. This finding agrees with other reports which indicated that gram-negative bacteria, mostly Escherichia coli and Klebsiella species, are the most common pathogens isolated in patients with urinary tract infection. And the prevalence of UTI occurred more in females, like I said earlier, as a result of the short urethra, which I showed us in the anatomy, female anatomy, than in males. Of the 120 isolates obtained, 110 were from females, while 10 were from males. This result also agree with other reports, which shows that UTIs are most frequent in females than in males during adolescence and adulthood. So I just cited few of the references amongst the others. So, okay, thank you for listening.